Hey, if you've got a mental health exam coming up, you are in exactly the right place. We've basically created a focused study guide to cover all the core concepts you absolutely need to know. No fluff. So, you ready? Let's just jump right in.
So everything we're going to talk about today really boils down to this one big question. It's not just about memorizing definitions for a test, it's about understanding what to do. What does effective support really truly look like? Nailing this is going to be key for your exam, and honestly, way more important for providing real compassionate care.
Here's the game plan for our session. We're going to start with the big picture, the why. Then we'll lay down the ethical rules of the road. After that, we'll get into the major disorder categories one by one. And finally, we'll wrap it all up with the must-know takeaways. It's a clear path to get you ready.
All right, let's kick things off with Section 1, the big picture. Because before we get into any of the details, we really have to get our heads around why this all matters so much.
Okay, so the first thing to get is that mental health disorders, man, they create this huge ripple effect. It's not just about one person. It messes with their work, their relationships, everything. And it puts a massive strain on families. Now, for your exam, remember this key fact. There's never a single cause. It's always this complex cocktail of biology, psychology, and what's going on in someone's environment. Think of it less like a single problem and more like a perfect storm.
Now let's talk about one of the biggest, most invisible hurdles in mental health, stigma. It's this powerful negative force, this feeling of shame or fear of being judged that literally stops people from reaching out for help. For your exam, you got to understand that stigma isn't just a side topic. It's a central piece of the puzzle.
Okay, moving on to Section 2. We've got the why, so now let's build our ethical framework. Think of these as the absolute, non-negotiable rules for providing compassionate care.
All right, this is a big one. You absolutely have to know this acronym, DIPS. It's your guide for pretty much every single interaction. Dignity, you see the human being, not just a label. Independence, you help them help themselves. Preferences, their choices, their voice, it matters. Privacy, you lock down their information. And safety, for them and for you. These 5 things, they're the foundation of everything we do.
So, with that foundation set, let's dive into Section 3 and start talking about specific types of disorders. We'll begin with some of the most common ones you're likely to see on your exam.
Okay, look at these two side by side, anxiety and depression. See how the support strategies are different? For anxiety, your whole goal is to turn down the volume. Think calm, quiet, and just listening. But with depression, it's more about offering that gentle encouragement, being patient and inviting them to do simple things without any pressure. The support has to fit the situation. And this is where things get really nuanced, especially with bipolar disorder. It's like you're dealing with two sides of the same coin. During a manic episode, your job is to provide calm, structure, and really firm boundaries. But then, when they're in a depressive episode, that focus totally shifts to emotional support and patience. But look, what's the same on both sides? Reporting changes and helping with meds. That consistency is absolutely crucial.
All right, let's shift gears to our next category in Section 4. These are disorders that can really impact a person's perception of reality and their self-control.
Okay, this is probably one of the most important things you'll learn about supporting someone with schizophrenia. The absolute golden rule is, you do not argue with a delusion or a hallucination. It just doesn't work. Instead, you connect with the feeling behind it. You acknowledge their fear by saying something like, "I can see that you are frightened." That validates their emotion without validating the delusion.
You're going to see a pattern here for these next few. OCD, personality disorders, impulse control. What's the common denominator? It's all about structure, patience, clear boundaries, and being totally predictable. With OCD, for instance, you can't just interrupt a ritual. That would send their anxiety through the roof. You follow the care plan. For the others, those clear, consistent professional boundaries are what make them feel safe.
Okay, let's move into our last big category in Section 5. This group covers conditions that are often rooted in trauma, substance use, and some other really complex challenges.
This slide is all about knowing your lane. Notice, for both of these, your role is supportive, right? It is not therapeutic. You're not the therapist. With eating disorders, you're like a neutral party. Zero comments on food or weight, you just follow the plan. With substance use, you're their non-judgmental ally, supporting the recovery and reporting any concerns right away.
When you're supporting someone with PTSD, your number one job, your guiding star, is safety. Creating a safe, predictable space is everything. You have to be aware of what might trigger them. And that last part, so important. Always ask for permission before touching. It helps give them back that sense of control they lost.
Okay, I want you to just stop for a second and really look at this slide. This isn't a topic we handle with gentle suggestions or soft skills. This is a 5-alarm fire, an emergency, period.
And this is your emergency action plan. Commit this to memory right now. Step 1, you take any talk of suicide seriously, every single time. Step 2, you never leave them alone, not for a second. Step 3, you call for help right away. And Step 4, you just stay with them and listen until help gets there. There are no other steps. This is it. This is what you do.
All right, let's wrap this all up. We're in the home stretch now. This is the stuff you absolutely need to have locked in for your exam. The final takeaway. So, if you remember nothing else, remember this. First, your approach. Always calm, always patient, never judgmental. Second, your guide. The care plan is king. Follow it. Third, your framework. DIPS. Always DIPS. Fourth, your main job. You are the eyes and ears. Observe and report. And finally, your crisis plan. Safety first, then call for help. You nail these 5 things, you're in great shape. And I want to leave you with this one last thought. The exam, yeah, it's about facts and protocols, but what happens after the exam? It's about taking all that book knowledge and mixing it with real human compassion. So think about it. Beyond the textbook, what does that really look like to you? Answering that? Well, that's what makes all the difference. Good luck.